Welcome to my work. Once more, today's topic shall be on the stomach ache, the pains we feel around the stomach, and the investigation on those pains. So the first aspect of my presentation shall be the preamble on the case study, and then we move on into talking about the various regions. There are about 9 quadrants. So these various quadrants contains various organs, and those organs, when they are infected or they have a complaint or inflamed, it comes out as pain, and that is the pain we experience. So I move on from there to talk about the causes of those pains, and also there are the investigations, both laboratory investigation and invasive investigation that can be done. Even for cancer patients, you need a biopsy to confirm that it is a malignant tumor. If you like what you are experiencing, please click the like button, subscribe, and let the program continue to be a continuous program. Many of us have experienced stomachache. Hardly anybody living would say that he or she has not experienced stomachache before. You can imagine you driving on the streets on a journey to a long distance place, and the time is of essence. So as you drove along, the experience was such that the pain was excruciating. What would you do? You thought you'd be relieved if you should find a place to stool, but there's nothing coming out when you make effort to stool, but you keep experiencing serious stomach ache. So the best thing to do is, when it happens in the house, there is that need for one to really examine what if it's a localized pain or stomach ache. When it's localized, the picture, it depends on the region. Whatever regions you are talking about, the pain is coming from the area of the organs there. So you can have different kinds of etiology based on the organ affected. For example, if it affects the gallbladder and the liver on the right side, upper quadrant, you honestly will be thinking of a pain that has to do with gallbladder, cholecystitis, or liver problem, fatty liver, or even serious liver problems, or even up to pancreatitis. So, but the one that is commonly investigated in the lab are those pains that come with diarrhea or dysentery. These are the ones that you can easily know from the sample collected, that is feces. For the right upper quadrant, the test you will be doing the investigation is the liver function test, barium meal, bilirubin test, and that should suffice for real. We can move from here to the epigastric. At the epigastric region, you still have the part of the liver, stomach, and the pancreas. Like I said, the liver function test could be done. The stomach amylase test and pancreatitis function test could also be done, pancreatitis. So to really confirm whether there is also there, you could also do culture of that region of disease to get Helicobacter pylori. At the left upper quadrant, you have the stomach, pancreas, and spleen. And as I said, with the spleen, you experience splenomegaly, and the test you could do are more concerned with the white blood cell counts and full blood counts and other tests connected with the spleen examination. The spleen pains. So we perform various tests for all these organs according to their pain. So let's go into the gastroenteritis proper to explain more. Causes include diarrhea, dysentery. Causes allergic reaction, viral infection, bacterial gastroenteritis, parasite emmettes, and protozoa. Cancers, these are all causes. Then you can see the various estimate or in a year that these are ascaris. You can have up to billion, they are estimate. Then the list by frequencies in travelers. Usually if you are coming from temperate region, you find worms, ascaris, hookworm, E. coli, shigella, rotavirus, salmonella, campylobacter, gardnerella, entamoeba, histolytica. These are all agents of gastroenteritis. Dysentery, especially those who are located in the largest, really cause dysentery, like entamoeba, histolytica, and strongyloides. This is also the shape. You see more viruses in the US. Then these are the worms you want to talk about, the pinworms and the ascaris lobicus. This is Enterobius vermicularis, and the treatment includes hydration because majority are antibiotic, antiviral, anti-protozoan. So subscribe